pronounce a single one of the things that I ate, but they're all really good. Yeah, thank you for joining us. Every week we do this show. We try and bring new information, new topics, things that are useful for people that will help them in their fertility journey and bring it to your attention. There has not been a lot that's great out there recently that I could share with you guys. However, we will be doing one on frozen eggs because there was a really bizarre comment made by someone that I know who shall remain nameless so that I don't get in a lot of trouble for this about the success rates of frozen donor eggs in a very public forum. And what they said was just like wildly untrue. And so I want to kind of do something on frozen eggs so that people will know exactly what to expect if they're thinking of freezing their eggs. Because we do get a lot of people who contact us and say, I'm like 41, 42, I want to freeze my eggs. I just spoke with this lovely couple from out west. She had frozen her eggs at 41 years of age and was making 5 at a time. You need like 40 eggs at 40 to get 40 frozen eggs at 40 to get just one live birth. So 5 at a time, she'd be at it forever. The cost would be absurd, and it's probably not even worth attempting in many instances. So I think it's valid and valuable to provide people with the information that they need. So we're going to review a recent study. It was a meta-analysis where they actually looked at thousands upon thousands upon thousands of people that had frozen their eggs, and they looked at how many people came back to actually use them. You'd be astonished at how low the rate is. And then they actually calculated what percentage of those patients actually walked away with a live birth, not what you expect based on all the pumped up studies that are out there and claims. And then somebody went ahead even further and looked at what the per egg chance was, and it's far off from what this individual claimed on television recently. So we're going to bring that to your attention probably next week. Yeah, so I hope first day of school was good for those of you who are already parents and you are struggling with secondary infertility or just still watch the show after you've been successful. Hopefully your babies went to school and did fine. And for those of you that are still trying, we will get you there. Just keep at it, and we always find a way. So no great topic tonight, but we are going to take questions. So fire away. I'm ready if you are.
Ready. Is it true or false that you're more fertile after a miscarriage?
No, that's actually not true. Now, you don't need to wait after a miscarriage. We used to think you needed to wait a few months before you could try again. That's been proven to be not true. But you are not more fertile immediately after a miscarriage. You're just as fertile as you were before or after. It makes no difference.
Do you have any nutrition bracket vegetarian recommendations for the last few weeks before an egg retrieval?
Oh, sure. Mediterranean diet, low in fat, low in sugar. Try and take lots of fresh fruits and fresh vegetables, olive oil, that kind of thing. Less red meat. If you're going to have meat, try like a fish type of product, but make sure the fish is more organic rather than, farm bred fish. And aside from that, just take in lots of vitamins. So make sure your supplements are adequate. Your coenzyme Q10, your vitamin D, your iron, your Bs, B12 in particular. Make sure that you're taking some melatonin. So there's a lot of different things. Your fish oils, your prenatal vitamin, all of those can contribute to improved egg quality and sperm quality to some extent.
Can an at-home Doppler be used much? I read something about heat. Can be used too much.
Yeah, somebody stole one of our Dopplers.
No way.
Yeah.
Someone actually stole
Yeah,
it.
somebody stole one of our Dopplers. Like, who does that? I mean, we're here helping you. Why would you steal a Doppler? Like, they're readily available online. Why would you steal a Doppler? I have no idea. But whoever it is, if you do feel guilty, please bring it back because we're short a Doppler now. So, no, the Dopplers don't generate enough heat. to be a problem. Having said that, I never recommend people get them because you'll just go crazy not knowing where to find the baby, and then you're panicked and you're going in every 5 seconds going, oh, I didn't catch the baby and what's going on, and then we'll find it for you. So I don't recommend people do at-home Dopplers. It's of no value. You're not going to prevent anything. God forbid if there's something bad that's going to happen, an at-home Doppler is not going to prevent it. So don't do that. It just drives people crazy.
I think it's more important to watch this show than to have a
Than
Doppler.
to have a Doppler. I agree. I do too. Yeah. Watch the show. Don't get the Doppler.
I was advised by my fertility clinic to stop taking ASA if my pregnancy test is positive due to potential risks such as bleeding around the placenta. Can you clarify whether ASA should be stopped for everyone during pregnancy, or are there specific situations where it might still be recommended?
Yeah, so that's probably technically incorrect. The literature around aspirin is based on studies that looked at its use throughout the pregnancy. And while there might be a slight increase in subchorionic hemorrhage, no one's actually sure about that. So the studies do demonstrate benefits to being on aspirin throughout the pregnancy, not for stopping it as soon as you're pregnant. That's silly. A lot of what you're trying to avoid is actually preeclampsia, and you need it to be there at the beginning when you get pregnant, and you need it there past that time into the pregnancy to prevent the preeclampsia. So why would you stop it? That makes no sense.
And Dr. V&T.
There's a lot of stuff out there.
Oh.
That makes no sense. Wow. Speaking of which, Tarek and I are going to start a weekly program, which I think we're going to call the Dick Awards, which stands for Dumb Infertility Comment, where we hear stuff from other doctors or people about fertility that make absolutely no sense. So we're going to do a real formal. I'm going to wear some type of fancy outfit. We'll have a whole background for you. It'll look like the Academy Awards or something. But we're going to present a Dick Award instead. So let us know what you think about that. Hopefully it'll be a weekly feature, and we'll find something really dumb somebody either said to us or we read about that we can award with the Dick Award. I think it's quite fun.
I think there's a lot of winners out there.
There are a lot of winners out there.
There's a lot of winners.
I had several last week.
There you go.
Yeah.
Hi, Dr. V.
Yeah.
Stopping breastfeeding question.
Oh, okay, sure.
Can you specify how long you should wait from your last breastfeed to your next FET?
Probably minimum 6 weeks for your prolactin levels to go down enough to restore you back to normal. So we would recommend 6 weeks. That's a reasonable time frame. Yeah.
And after VNT, transfer delayed after 5 months Lupron and Letro due abnormal immune. Now on Vizan, the E2 is at 1050 picomoles per liter. Doctor said could be functional cyst. Do you suggest more Lupron and Letro for E2?
No, I'd suggest you get an ultrasound and figure out if it's a functional cyst. Not to mention the Vizan can give you some baseline level of estrogen as well. That's kind of high, but Vizan can cause some estrogen rise. So make sure you're on the right meds and the right combination. And there's not a ton of data on using Vizan prior to an FET. So keep that in mind also. There is a little bit, but not a lot.
Hi, doctor. Do you have any particular supplement or diet or timing to help with conceiving a baby boy?
Oh, yeah, that's a great question. So lots of people have tried lots of things and none of it works. It's been studied inside out, upside down. Yeah, it's all nonsense. There is nothing that will help you conceive a boy versus a girl.
I actually have something.
You do? Really?
Worked 100%.
I can't wait to hear this. Please.
So,
yeah.
After a lot of
educate us. I can't wait to hear
and trial and error.
Uh-huh.
I have a boy. I have 2 boys.
You have actually. 2 boys. Yeah.
So it's very, very simple.
Okay.
So I hope everyone gets their pen and paper out.
Pen and paper, people. This is Dr. T.
This is serious.
Yeah.
So at first we had girls.
Yeah.
Okay. So then we tried again.
Which you love, and they're wonderful.
They're fantastic.
Yeah.
So then we had a girl again.
Yeah.
So then Mark said, "Don't you think we should have a boy?" And I said, "Well, whatever we get, we get. And there's nothing we can do here."
Yeah.
but deep down inside,
You thought there's got to be something we
I
can
said,
do here.
we need a boy now. Guess
Yeah.
what?
You got a boy.
Got a boy.
So you think it's just
Not
telling
just-
yourself.
Hold on. And then my wife said, don't you think he needs a friend to play with? I said, you're right. And guess what? Had a boy.
So you think it's mind over sperm?
It's all mine.
It's all mind over
It's super powerful up here. You got to be thinking with the right head.
You managed to actually mentally tell your sperm to segregate into male and female sperm. Yeah, that's not
The
happening.
problem for most men is when they're in the moment, that's not what they're thinking about. I was able to focus. For those that want the answer, there it is.
There it is. Yeah. Don't listen to a word he just said. That's a lot of bunk. So, or in this case, spunk, I guess. So, yeah, no, there is no way to identify or select one gender over another when trying to conceive naturally. Yeah, that doesn't happen. It doesn't happen at all. There's no way to do that. You can't segregate sperm populations. You got to remember there are millions and millions and millions of sperm there doing the job. And like relatively half are female, half are male sperm. So the idea that you're going to like retard one sex over the other with some technique, it doesn't work that way. Like the sperm are just sperm. The male sperm and the female sperm don't segregate differently. Back when I started fellowship, there was a company called Microsort. Microsort developed this differential centrifugation technique, which they claimed could pick a boy, I think it was 80% of the time, and a girl 60% of the time, some number like that. I don't remember the specifics. And they sold this and people bought on. Loads of people tried it, and after a little while, they figured out it was a complete scam and it didn't work, and the company got shut down. So, yeah, there's no way to do this. People have tried stuff. I've heard have sex 3 days before it's been studied, useless. I've heard the Chinese calendar, absolutely useless. I've heard, of taking warm foods versus cold foods, yin and yang, all sorts of different things. Have yogurt, have this, have that. Yeah, it's all BS. None of that stuff works. Yeah. And so is tarts. That doesn't work either.
Well, you could say what you want, Dr. Victor, but the results say otherwise.
The results speak for themselves. Yeah, we're gonna have to get we're gonna have to get you to try again. Yeah,
problem.
we're gonna have to talk to Merv. Merv, if you're watching the show,
You know what we actually need to do? We need to do a clinical trial. That's what we need to do.
That's how you're gonna justify it
That's
to
how
your
we're gonna-
life.
How many times can I do it? In the name of science, of course. In the name of science. To better humanity.
Like I said, this show goes off the rails all the time. All right.
All right, back to the real question.
Yeah.
One very important question
Yeah.
by an Instagram viewer that is clearly 100% in the show.
Yeah.
Where do we submit
Yeah.
for the Dick Awards? And can we nominate a year-end winner?
Oh, we should do that.
Absolutely.
We could have like a whole Dick Awards presentation.
Yeah, I think it deserves a spot on your website,
Yeah.
and maybe in your Instagram or something, submit a candidate for the.
Yeah. How can we do
Yeah,
that?
well, I'll spruce it up for you. We'll do
Yeah.
that.
All right.
That's for sure.
Tara's going to set that up for you. Yeah. And we would love to hear whatever you think.
By next week,
yeah.
we will be taking nominations. By next week.
Yes.
we'll
Send
be
us
taking
your stuff
nominations.
because I would love to, comment. We just did one that would definitely qualify as
definitely
one of the
qualify.
all-time winners.
Absolutely.
So there's a lady that called IVF immoral and then came up with a whole bunch of like bizarre psychotic comments about stuff that's absolutely not true. So we just made a video about that. That'll be up soon. But anyways, we've got one from Katrina in Canada with lips and Canadian flags. Why so much IVF these days? Back in my day, we didn't do this.
Mhm.
Well, infertility is rising. It used to be like less than 10%. Now it's 15 and it's on its way to 20. There are estimates that by 2050, 50% of men will be infertile. So it's rising because we need it, because our population is becoming less fertile. Why are they becoming less fertile? It's another story. Most of it's probably environmental exposure, smoking, drinking, marijuana, drug use, bad diets, crappy food, not enough exercise, living in your phone 24/7, all the stress, all the anxiety and stuff like that. So there's a lot that goes into it. Some of it's infectious, some of it's genetic, but there are a lot of environmental factors that are contributing.
Hi. My first HCG beta was on Thursday at 1:31.
Okay.
Today, it was 2:59.
Okay.
Any possibility of hope?
That's going to be fairly low. So by Thursday to Saturday, you should have gone up 60%, which would have meant you should have gone from roughly 140 up to about another 80. So that would have been 220. And then you should have gone from Saturday till Monday up another 60%. So now you would have been up in the 300s and then another little bit because it's Tuesday. So it's unlikely that is normal, but anything is possible. And it depends on what day they checked you as well. So there's always hope, but probably a relatively low level of hope, unfortunately. Sorry.
Is Tylenol cold and sinus okay during pregnancy?
No. Anything that says cold and sinus has phenylephrine in it or ephedrine. And because of that, it causes diffuse vasoconstriction, which means your blood vessels are snapping shut. Because it's non-selective, it'll happen in your nose and your sinuses, but it'll also happen in the uterus and the placenta. You can't do that because it reduces placental blood flow. So those are not safe when you're pregnant. You didn't know that?
I knew it was no good,
but you
didn't know why.
Yeah, that's why.
My DR just raised a notch.
Your DR just raised.
Second pregnancy, 18 weeks along with an anterior placenta and not feeling flutters yet.
Yeah.
Is this normal?
Totally normal. When the placenta is anterior, you just don't feel it the same. It can be 24 weeks before you read it. You feel it regularly. That was Chel's.
Mm-hmm.
Chel's now says, dang it, she took it for 2 days. Avoid the cold and sinus stuff, Chels.
Be careful, yeah.
Please, yeah. Chels, just reach out. We'll see it. Say it to you. Carly, I miss seeing you. I didn't get to say goodbye or even see you. I know, I'm sorry, Car. Come by. Come by. Bring the baby. I would love to see you and the baby.
Is it okay to take inositol if I don't have PCOS?
Yeah, it's a very good anti-inflammatory. You don't have to have PCOS for inositol.
She followed up with to help with egg quality.
Yeah, it can. I mean, if you have inflammation, it could be used,ful. So yeah, for sure. Can I just take a second to thank everybody at the hospital today as well? I need to thank everybody. So we had a very unique case today where we needed to arrange an egg retrieval at the hospital. And to my amazing team and to the amazing people at the hospital, including the nurses, our anesthesia chief, and the phenomenal Devin Lansbury, who was tremendous in helping all of this come true, as well as Deidre Nielsen. Thank you for all of your efforts because we were able to save a huge number of very beautiful eggs for this amazing young lady who needed this done. And so thank you to everybody for making it a Windsor first. It's never been done before in the hospital. And we made it come to reality. So it was super cool. I couldn't do the case in the office because she was too sick to do it. So we took the lab to her instead of bringing the patient to the lab. What's that phrase? Take the mountain to Muhammad instead of Muhammad to the mountain. Is that right? Is that it? Yeah, there you go. Yeah. So we took the mountain to Muhammad. It was kind of cool. Yeah.
What does it mean when PGT comes back as invalid? Is the patient's refunded for no test results?
Yeah. So you got to understand that we're only taking a very, very small amount of DNA when we would do the biopsies. And that DNA has to get all chewed up and processed. And then it gets thrown into a PCR machine whose job it is to make millions of copies of the DNA that's there. And if for any reason, the primers that have to bind to the DNA, which allow it to recreate millions of strands, just doesn't start off right, it doesn't bind, the chemicals are wrong, whatever, the process is somehow glitched, it just doesn't work. So depending on what sort of process they have in place for you, from a billing perspective, you may or may not get a refund, but it would depend. And you can't blame anyone because it's just like it's part of the test. Sometimes it just doesn't work. So it's not like people weren't trying. We did our job wrong. Somebody else did our job wrong. It's not about that. Sometimes the test just, you can't amplify the DNA, and you have to amplify the DNA in order for it to work.
Hi, Dr. PNT. What is the effect of boric acid on endometriosis? Is it bad or not?
I'm personally not aware of any impact of boric acid on endometriosis. Boric acid works well on endometritis because it breaks down the biofilm layer that bacteria create to protect themselves and lets the antibiotics get in there, as well as lactobacillus get in there and kick out the bad bacteria. But I don't know anything about boric acid and endometriosis.
First time I heard of it as well. Thought I'd put that out there.
Yeah, thanks for that. Yeah.
Hey, Dr. Victor, delivered my son in 2014 at Met. This is so random. He's on here.
There you go.
See?
That's cool.
And then Charles responded saying he's a star.
Well, I'm not a star, but we try and do our best, for sure.
Back to Instagram. HCG was 303 on 15 DPO, and a 3+ weeks on a digital on 18 DPO. Is this average or above average?
That's normal for that stage, so that's probably fine.
Have a doubt if the, oh, hold on. Okay, there's a gap in the question. Let me read it to you. Hi, Doc. I took letrozole 7.5 milligrams the past 2 cycles.
Okay.
This cycle, I didn't take letrozole, but had a follicle of 14 millimeters on CD4, 20 millimeters on CD8. I was told to take Overdrill on CD9.
Yeah.
My ovulation strip's positive.
Yeah.
Have a doubt if it was just a follicular cyst from the previous cycle, as it was too big on CD4. Your thoughts, please.
I'd need to know your estrogen levels to be able to figure that out, and you'd have to follow your progesterone levels to know if it was or not. My concern would be less that and more just was the endometrium synchronized, which it likely wouldn't be if you were ovulating by day 9. So that might be tougher, but it would depend on what happened with that cycle, and you'd need hormone levels to know.
How long do you recommend to continue progesterone supplements after an embryo transfer?
We continue ours straight through till 36 weeks. We stop the oil at 12, but we continue the vaginal till 36 to reduce the risks of preterm labor, which patients with IVF are at higher risk for.
Is AMH of 3.5, 35 years old, good for fertility or IVF? Thanks.
Depends on the units. 3.5 picomoles per liter, that would be low. 3.5 nanograms per mil, that would be awesome. So it depends on which units you're using. We had a patient on TikTok just ask if her period would be heavier after she had scar tissue removed at the time of hysteroscopy. Not usually, no. Yeah, not unless there was a ton of scar tissue and they gave you a lot of estrogen.
Listen to this.
Yeah.
Can you talk about spotting after an FET and during the first week until clinic discharge? What's normal, what's not?
We just made a video on this. So the reality is that spotting is never really normal. So you shouldn't really be spotting. We would want to know why you are spotting. And so that's something that needs to be looked at pretty carefully. Now, if they irritated the hell out of your cervix, which happens sometimes when we do frozen embryo transfers because the cervix is tight or whatever, that's one I wouldn't panic about. And I always warn my patients, you're going to get some spotting because we see it there at the time. So if you're getting spotting immediately after and it's trickling down for a couple of days, that's probably just from cleaning your cervix. But if it's from something else, then that's a different story. And you would need to make sure you don't have polyps or fibroids or your hormones aren't out of whack or something along those lines. Cervical infection, vaginal infection.
Good evening, gentlemen. I have a wholesome diet along with the omegas, vitamin D, 1 milligram folic acid, and Fairmax. Do I still need to take prenatal? I find that they have a subpar quality.
Not if you've got folic acid, iron, vitamin D, most of the other vitamins, the Bs and all that stuff, fish oils. No, you don't have to take it prenatal. The key things we're looking for are iron, the B vitamins, the folic acid, or methylfolinic acid, and then you want some fish oils in there as well.
When would you recommend continuation of blood thinners / immune meds past 12 weeks? Do RPL patients need any special monitoring after 12 weeks? Thank you.
Depends on why they have RPL. Some patients would, like lupus patients. Other patients probably wouldn't. We don't continue past 12 weeks except for intralipids. The other things we stop.
Bringing you brownies for our appointment on Monday, September 9th. So make sure you grab them.
I love brownies. Walnuts, please. Love my brownies with walnuts.
Make sure there is an allocation
for Tarek.
For
Dr. T needs an allocation.
I won't be able to function on Saturday. On Tuesday, knowing that now.
Hi, Dr. V. Can you explain why the letrozole with Lupron for 90 days protocol? Because that's the only thing that's been proven to be beneficial. There's now 3 studies showing that Lupron with letrozole prior to FET is beneficial for endo patients. Lupron alone has never been shown to be beneficial. And people keep asking me about Orilissa. Not a single study, not one. There are no studies on using Orilissa prior to frozen embryo transfers. So it might be great, but it doesn't make sense for endo patients because Orilissa keeps your estrogen levels in the mid-follicular phase, which is not where you want it to be if you're doing an embryo transfer and you have endometriosis. So that was a dick award too, because we had someone whose doctor told them that Orilissa was fine because it reduced your estrogen levels. It doesn't. Yeah. I love the amount of misinformation out there. It's crazy. There's another one here real quick. Is 5 follicles worth doing IVF? Yeah, that's a great question. So the answer to that is it depends on what your body's capable of making. If your body's capable of making 20 and you only have 5, no, of course not. But if you're only capable of making 5 and you've got 5, well then sure. Or if you're capable normally of making 3 and you've got 5, absolutely. We have loads of cases where we only get 1 egg. We do natural cycle IVF. Those patients get pregnant. So in fact, I signed someone up for it today because they didn't do well with the medicated cycle. So you don't necessarily need a ton of eggs. You just need one good one.
Dr. V, 36 with endometrioma, 2.5 centimeters in the ovary, 1 failed IUI. Normal labs, AMH 6.1. Do you recommend surgery or going to IVF?
It's a pretty small endometrioma. So what we would recommend to our patients, and I'd need to know you fully and give you advice personally, but I can't do that. But I can tell you what we would do for someone like that in our practice. We would probably talk about the options. And if you were thinking of doing IVF, we would definitely do all your IVF first and then do the surgery. I'd probably be quite reluctant to operate on you before doing IUI, because IUI has a 15-20% chance in the best circumstances. Even if with endo you're half that, you're like 7-8%, 10% chance. So now I operate on you, which is major. I weaken your ovaries no matter what I do, also major. And then I've increased you to 15 to 20%. It's not like significant enough in my mind to merit the surgery. It just doesn't make sense. But it's certainly reasonable for someone doing IVF because now you're talking a huge change in numbers.
Hello, Dr. VNT. What do you normally treat high TH1, TH2 ratio with?
Either rapamycin or tacrolimus. You can also use Humira. It depends on which cytokine is elevated, your interferon gamma or your TNF alpha. There's different drugs. You can use Plaquenil as well. Many different substances will control the different branches of the cytokine elevation.
Potentially one of the most important questions asked.
Yeah.
I'm about to read to you.
Okay. One of the most important ever, or just tonight?
Tonight for sure.
Tonight for sure. All right.
And they sent it straight.
Drum roll.
There's no T in this. It's strictly you. Hi, Dr. V.
Okay.
Looking for a pep talk.
Oh, a pep talk. All right. Talk to me.
Can you tell us a success story of a couple with endo and balanced translocation, no donor egg, please, mid-30s?
I actually have a success story of a couple with endo and a balanced translocation. They did get pregnant. So yeah, I mean, it's possible. The key is you will need more eggs in that situation. Keep in mind that endo has negative impact on the number of eggs, the quality of the eggs, the maturity of the eggs. So you'll need more, but it's just purely a numbers game. You try enough times, you'll make it happen. So it is possible. You don't have to turn to donor eggs in those situations. It is definitely very, very possible. And we have had success at least once off the top of my head that I can remember. I'm trying to remember if there's a second. Yeah, we have a second one as well. Yeah. So there's two. Yeah. I mean, it's not a common occurrence, but balanced translocations are pretty rare.
Hi, Dr. Victor and Dr. T.
That was a cool question.
I thought you'd like that.
Yeah.
And you stated it quite well. You look like you were answering the question fully. I have to be honest. It looked good. Now, a question for the two docs here, Dr. Factory and Dr. T.
Oh.
I have high FSH looking to do another retrieval.
Okay.
How should I prime for this? I.e., take birth control for 2 weeks before new cycle? Absolutely not, is what I would say.
Even T knows that one. No. No. So things that are useful for priming that have been shown to have a benefit, DHEA, testosterone, human growth hormone. Things that are either useless or detrimental, estrogen priming, and definitely birth control. That would be detrimental. No one should be on that prior to doing a stem cycle. So DHEA, testosterone, human growth hormone. PRP is questionable. I get a lot of requests from older women who want to do PRP. If you're younger, it's fine. If you are older, it's not really going to work because the math doesn't favor it.
Is your Woodstock location open yet, or St. Catharines?
Woodstock should be any minute. The lease is with my lawyer. St. Catharines is open. So please feel free to go to St. Catharines. We're still sorting out the monitoring, but it's coming along. One of our patients on TikTok just said that she just put her 1-year-old to bed, which came into existence after just one round of IVF with us. So yeah,
absolutely
pretty cool. Yeah.
Talk
to me, Goose.
Dr. Twin. Oh, not sure if I should. Dr. T for the first dick award for the gender comment. Shouldn't have read that. But you know, I'm biased here. We need everything.
Awesome. I love that one. That is legend. Legend. I don't think you'll be reading any more.
Oh, T, that's a submission to the Dick Award. Dr. T wins the first Dick Award.
No. The first Dick Award goes to a fertility specialist in Ontario. That's as detailed as I'll get it. Who apparently told the patients that it's okay to do an IUI 3 days after the patient ovulated.
Whoa.
You got 18 to 24 hours in theory from ovulation. It's probably more like 8 to 12 to fertilize the egg. And this individual, who shall remain nameless because I never like to pick on people specifically, said that it was okay to do it 3 days later. The egg is gone. It's like toast. Yeah, so it just fizzled out and died. Like, what are people thinking? That definitely deserves the first Dick Award.
You know, I don't even know why I'm nominated, to be quite honest. I actually did it at least. You know, it happens.
T's feelings are hurt, guys.
Maybe it wasn't the most applicable advice one can give, but it doesn't negate the advice. Mind over matter.
Oh, that's legend, man.
I'm the first winner. Yeah. Another victory for Dr. T.
I can't see who that is on the TikTok. It says my Ari deserves one. LOL, you know who, and I don't know who. I can't see.
You can only imagine.
Yeah, who's the person saying it?
Chell said it.
Oh. We're gonna get ourselves in trouble. All right.
Sorry, T. Your humor is why we love and appreciate you. So please don't boycott us. Yeah, people have to remember. I also ask the questions.
Yeah, he does ask the questions.
Quite a powerful seat.
I don't even see what's coming. Yeah. I see it on TikTok because there's a computer screen over here I can watch.
Yeah.
Yeah.
The best doctor I've ever been to. You're simply amazing.
Oh, thank you. Thank you.
You did not win the DIC awards. That's not for everybody. Cream of the crop, as we say. Dr. V and T, for FET prep, do you think Lovenox is better to try instead of baby aspirin, or should I advocate for taking both? Please help me understand the reasoning. Thank you.
So baby aspirin you use for improving blood flow, endometrial thickening, reduction of preeclampsia, reduction of preterm labor, all of which have been shown to be side effects of it that are beneficial. And probably an increase in success rate. Lovenox you only use if you either need an extremely strong anti-inflammatory or you have a blood clotting disorder, MTHFR, you've got factor V Leiden mutation, prothrombin gene mutation, whatever, one of those ones. I can rhyme them all off, but I don't think you need me to do that for you. So if you have one of those, you use Lovenox. Otherwise, they're not the same thing. You don't use them interchangeably. Like heparin doesn't reduce preeclampsia.
Do you recommend any specific protocol for Hashimoto's patients?
So one of the upcoming episodes is going to be on a special adjunct treatment for Hashimoto's patients. I was hoping to get it ready for this week. I just couldn't do it for technical reasons, but there is apparently a protocol that is good for those patients, and it has to do with steroids. So I'll have a look and I'll let you guys know, but there is a whole meta-analysis on the use of steroids for patients with Hashimoto's that apparently suggests a benefit. So I think we're going to probably start doing that for patients with thyroid antibodies.
I'm not sure if you asked this or not. Hi, Dr. V. Can you explain why the letrozole with Lupron for 90 days?
I did. I answered that one. Yeah.
Do you ever think intralipids for endo patients if they get pregnant naturally?
Yep. Yeah, for sure. Nothing wrong with that. We use it as part of our endo protocol. Why wouldn't we do it for someone that's pregnant naturally? Absolutely.
I'm taking Selexin and the bruising is so bad.
Clexane.
Clexane?
It's the Australian and European version of Lovenox heparin. They use something called Clexane. Yeah.
The bruising is so bad.
That's just the comment.
Is it okay to inject into a bruise?
Oh, yeah, no, don't do that. Find another spot. But before you inject, make sure you're not in a blood vessel, because that's probably the number one reason why you bruise.
Can lit therapy have side effects? Also, typically, how long is your immune protocol?
Can lit therapy have side effects? Sure. Scarring, allergic reactions, dermatoses. You can have various reactions. If not done properly, you can have a blood reaction that can cause isoimmunization as well. How long is our immune protocol? We don't have one immune protocol. We custom tailor our protocols to whatever's wrong with the patient. So sometimes it's 5 days, sometimes it's months. It depends on what's wrong. There's no such thing. Well, I shouldn't say that. There shouldn't be any such thing as an immune protocol. There is a very well-known clinic in the States. Wow, they deserve like the legendary Dick Award. So there is a very well-known clinic in the States that just, if you fail your embryo transfer, they just like give you everything. Neupogen and lit and, well, they don't do lit, but they'll do intralipids and steroids and tacrolimus and this, that, and they just give it to you all. It's like, you know, the famous adage of throwing the noodles at the wall and hoping something sticks. That's what they're doing. That doesn't make sense. You can actually probably do harm that way. So we don't do that. We test, we figure out what's wrong, and we address it. Yeah.
Can ovulation be off cycle after an egg retrieval? Thanks.
Can ovulation be off cycle after an egg retrieval? I'm not sure I understand that question. If you're doing an egg retrieval, you're not really getting a chance to ovulate because we're sucking out all the eggs from you. So you would not ovulate at the normal time. You'd ovulate when we triggered you to ovulate. If you're talking about your next cycle It can definitely be off because typically you'll have much higher progesterone levels, so your next cycle wouldn't necessarily occur exactly when or how you think it would.
5 weeks, just had some cramping and light pink bleeding.
Oh,
Does this mean a miscarriage?
no. It means you need to go get checked out. So get your beta done, get an ultrasound, make sure nothing's wrong.
5 weeks, just had some cramping and light. Oh, sorry. Hello. What do you normally treat high TH1, TH2 ratio with?
We did that one.
We did that one, yeah.
Yep. It's amazing how many people like
Oh yeah,
they jump back and forth.
I know, there's a lot of jumping.
Yeah, yeah.
How long does it take to get a consult with you? I'm actually available right now.
It depends on the urgency. So, I had someone that was going to do an unnecessary surgical procedure in Toronto, and I just felt bad that she was going for it. So even though we have a month's long wait, I wasn't exactly going to let her subject herself to an unnecessary surgery. So I jumped on a call with her yesterday. So if I have to, because it's urgent, I'll make time. If it's reasonable, right now we're like 2 or 3 months to get in to talk to me. But, if you have a reason why I have to see you sooner, let me know. I mean, obviously we are trying to accommodate everybody as best as we can. Yeah.
Are there any maternal conditions that increase the age-related risk of aneuploidy, like endometriosis or POI?
Well, endo does increase the chance of aneuploidy. POI is controversial. So there are people, myself included, that believe that diminished ovarian reserve, premature ovarian insufficiency patients have poorer quality eggs and require more, or not require, end up with more aneuploid embryos. Having said that, there are other people that don't agree with that. So at ASRM last year in New Orleans, there was actually a panel debating that exact topic. And half the panel said, no, it does. And the other half of the panel said, no, it doesn't. But I disagree with the half that said it doesn't. I think it does.
Dr. Banti, what is your progesterone protocol for natural modified FET? And do you recommend immune testing by Fertility or just microbiome?
Well, it depends on what's going on. In many cases, we recommend both the microbiome and the immune testing, but I mean, it totally depends on what's wrong. Our progesterone protocol, we use PIO and vaginal progesterone, and then we custom tailor the dose to your situation, and then we follow it with measuring so we know, what to do for each patient.
Hi, Doc. I'm in Ottawa. Partner got bad COVID 2 weeks ago.
Oh.
Planning to thaw 22 of my eggs and do a fresh egg retrieval next month. Doc said sperm could be affected, but we should be okay since using ICSI. I'm 39. He's 43.
Great plan. I love it. However, I wouldn't do any egg retrieval or thawing of eggs until you had actually had a sperm checked before you begin. Because if you had high fevers, there can be damage to the sperm, and that can last several months. So the newer strains of COVID are not being studied for their impact on sperm. The original strains definitely had a very negative impact. So it's worth getting tested before you start so you don't waste a lot of money on your drugs. So make sure you ask them to do a sperm test first and look at the numbers and make sure you understand them. Don't just take it for granted, because sometimes they tell you it's fine, which I hear all the time. And then when I read the numbers to people, they're like, we weren't told that. Like, why weren't we told the motility was low or the morphology was low? And then you find out they were told IVF would fix it. IVF doesn't work well when you have terrible morphology. Like, you still have to find good sperm to inject, and it makes it way harder if you don't have good sperm.
17 weeks pregnant with my second.
Okay.
So far, not feeling any flutters or movement. Is this normal?
Yeah, 17 weeks is when you would just start to feel something, and that's if the placenta is posterior. If it's anterior, you won't feel it for another month and a half, 2 months.
Could you explain why endometrial polyps form?
I could if I knew, but I don't. Nobody knows. Some people think it's related to estrogen excess. Some people think it's related to the menstrual cycle itself. Nobody knows. So we don't know the answer to that.
I don't know.
You don't know either.
Yeah.
Tarek doesn't know either. I mean, that makes two of us.
Yeah. It's an anomaly right now.
It's an anomaly, yeah. Yeah.
Hi, Doc. I have endometrioma, 3 times 2.7 in the right ovary.
Okay. 3 by 2.7. Yep.
Yeah.
Yep.
I'm on letrozole 7.5 milligrams.
Okay.
Take Overdrill, shot around CD10. Please suggest on what is the right time to take progesterone. HSG test shows tubes all clear. Followed by, could you please suggest on how to improve sperm morphology? He has good count and motility, but 100% head defect.
Oh.
0% in morphology, Kruger.
Okay, so first of all, that protocol makes no sense. There's no protocol which allows you to just trigger on day 10. You have to have your follicles monitored to see when you actually reach the right size, and it should be triggered based on the size of the follicle, not on the day of your cycle. So we don't work that way at all, and I can't advocate for that because it's actually complete nonsense. That would be worthy of a Dick Award. From the sperm standpoint, that's easy. Watch our video on sperm, and Tarek should be able to find the link on the sperm one if you want to pop it up there. Can you do that?
Mm-hmm.
So we'll put up the link for you to click on that. It's on our YouTube channel. So if you go to the guys section on our YouTube channel, it's like the most popular video there. So it's really simple. There's 4 or 5 things you can do. 1, no smoking, no drinking, no drugs. And people always say, what do you mean by no? I mean 0. No smoking, no drinking, no drugs. 2, you need to ejaculate every day or every other day nonstop. 3, take fertility vitamins and supplements and clean up the diet. So low cholesterol, low sugar, don't eat too much, balanced, healthy meal and diet. And then 4, make sure that you are addressing the heat of the testicles. So don't wear anything tight. Don't put your cell phone in your pocket. Don't put the laptop on your lap. Sit on frozen peas for 20 minutes a day. That all will help cool the testicles. The cooler they are, the better they function.
QR code in the top left corner of the video.
Here?
Yep.
There it is.
There is the men's sperm video.
Excellent. There you go.
For all to go.
Click on that.
It's right there.
There you go.
Can't miss it.
Yeah.
I'm going to keep it up for a bit as well.
There you
go. For vaginal prod with capsules, should they be punctured or just inserted and wait, hope they fully dissolve?
They don't need to fully dissolve. The capsule has a ability to kind of crack, and then the fluid inside is containing the progesterone, but the progesterone rapidly gets absorbed. The rest of it is all called vehicle, and the vehicle just comes out. So you don't need to worry about that.
My RE isn't aware of studies for adding letrozole to Lupron. What dosage would you recommend?
5 milligrams a day. Tell your RE to read more.
At 40, typically, what's the chances of having a miscarriage, genetic abnormality with the baby?
Miscarriage, naturally, probably somewhere between 30 to 40%. Abnormality, probably around 1%, 2%.
As someone who had failed an FET, how can I better prepare for the next attempts?
Healthy diet, lots of vitamins, weight loss if your weight is an issue, low inflammation, meditation, yoga, and then talk to your doctor about what options are available to you to improve your chances. More testing, more treatments, whatever the case is.
Good afternoon, Dr. NT. Is it better to take folate than folic acid?
Folate and folic acid are the same thing. Methylfolinic acid is what you're probably thinking of, which is what we give to patients with MTHFR. You don't need that unless you have an MTHFR mutation.
My wife did an ovarian cyst surgery last week, Saturday. One of her tubes is open, which is her right ovary, but left side, not so good. Can we do IUI or IVF?
You can do whichever one you want. I mean, if your one tube is damaged or blocked, you still have the ability to get pregnant, so you don't have to feel like you have to do IVF, but you would probably do better with IVF.
Here's a great question. What question do you wish people would ask in follow-up appointments post-retrievals? Only one euploid, 39 years old.
Why? Why did that happen? Why did I only get one embryo after an egg retrieval? That's a fair question to ask and deserves an answer. I would then want to talk to or have them ask what can they do to do better. And then I would want them to ask what options there are aside from just doing the same thing again, because I don't believe in telling people to just do the same thing again. So I always cover those things when I'm talking to people. They don't need to ask, but those are the questions people should be asking their RE.
My body is struggling with HG levels every time I get pregnant, and I have to be on blood thinner needle injection.
With HG?
Maybe HCG? I don't know. It says HG only.
I don't know.
Just a thank you for all that you do, Dr. V.
Aw, thank you. Appreciate that.
Is it possible to do an IUI if the semen analysis shows that all the sperm died after 24 hours? What can be done to improve sperm quality and longevity?
So the study that we reviewed on the show probably 3 years ago, maybe even more than that, showed that if you had less than 56% overnight survival, you had a less than 3% chance of success with IUI. So how can you prove it? Same things I said earlier. Is it still up there?
I've left it up there.
Click on that link. It'll tell you exactly what to do. So follow the instructions in the video.
Does boric acid produce estrogen? As I am currently suppressing and I don't want anything.
No.
Is it safe to take Reactin going into FET? Seasonal allergies are killing me right now.
Yes. In fact, there's some evidence now that I need to explore talking about IgE levels and fertility. And I have a patient with sky high IgE levels. So it may actually be beneficial to take Reactin.
Does placenta encapsulation really have
encapsulation? Yeah.
Encapsulation.
Okay, so let's talk about that. I love this one.
Encapsulation.
Yeah. So, does everybody know what placental encapsulation is? No, you don't know what it is. Okay, so placenta comes out and you take your gooey, yucky, blood-covered, disgusting, being exposed to every body fluid imaginable and likely some stool, and you hand it to someone who puts it in a plastic bag. You now take this blood-filled plastic bag placenta home, or you give it to usually a midwife or a doula, who will take it home and put it into an oven at 450 degrees for 3 hours. Okay, what happens to placenta at 450 degrees for 3 hours? It turns into char, literally char. Okay, so then you take it and you bash it so that it turns into a powder because it's char. And then you take the powder and you buy like dissolvable edible capsules and you stuff the placenta char into the capsule. So what you're doing is eating a carcinogen because they burnt the snot out of the placenta. And so you're literally eating something that causes cancer. So are there studies that demonstrate that this is beneficial? Nope. Is there any study anywhere that shows that eating placenta, even raw, is beneficial? Nope. Is there any evidence whatsoever to suggest that it's safe? Nope. Are there risks to taking it? Absolutely. People have actually died from septic infections from group B strep from eating raw placenta. So if you're going to do it, you need to eat it raw, like basically sushi, immediately after it comes out. And if you do that, in my opinion, you're nuts. So no, we don't recommend that you do that. You gotta, yeah, placental encapsulation.
No wonder I never heard of it.
Yeah, it's like crazy. It's something promoted by.
They never taught me that in med school.
It's something promoted by the crazies. Yeah, years ago, I was on a flight back from. I think I was on a flight back from Brussels. And I was flipping through my Instagram and there was that lady making like a placenta smoothie. And I was on the plane. Yeah, yeah, yeah. And I was in my plane seat and I was like, this is a great nope video. And I went, nope. And yeah. And then I had a whole post about it. Zero evidence and it can be harmful. So yeah, no, you can't do that. That one actually got a lot of views too.
Let me ask you,
Okay.
as a person looking for answers,
Yeah.
as an ignorant male, how about that? Let me really put it in perspective here.
You were a recipient of the Dick Award.
Yeah, so this is lined up for my second honorary inclusion for another award.
Okay, here we go.
Now, this is not meant to offend,
Okay. Understood.
but eating your placenta,
Yeah.
is it not in any way similar, maybe, to cannibalism a little bit? Like, how is that viewed? Like, you're eating yourself, aren't you?
Well, I think cannibalism specifically refers to eating human flesh. I guess it's not like flesh. It's afterbirth. It's different.
I don't know.
It's the equivalent of eating liver.
No.
Yeah, it is.
Human liver or any animal liver?
Animal liver.
No way it's the same.
It's the same thing.
Can't be.
Well, it filters the same way.
Yeah, but one's a human's placenta and one's an animal.
Oh, yes. No, I get, I'm not, yeah.
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 Animal, like, when you're in, like, let's give a great example. If you're in Egypt
Yeah.
and you got a sheep,
Yeah.
you're chopping that up and you're eating everything. And
Yeah.
you're using the fur for a winter jacket. Like, you're
Right.
not leaving anything behind.
Right.
But when it comes to humans,
You're not,
you don't do anything with it.
right.
But none of that is usable.
They're getting put in a pyramid.
That's it. You're put in the tomb. That's right. You take your organs and you even mummify them
Yeah.
in ancient Egypt, as an example.
Yeah. So, yeah, I mean, I guess it could be viewed as cannibalism. I'm not opposed to that. I'm not opposed to that.
Wild thing.
It's stupid.
But when you burn it,
It's stupid.
even to the encapsulation party, once you burn it to a crisp,
Yeah.
isn't like if there was nutritional benefit, let's say there is tons of nutritional benefit, just devil's advocate. Once you burn it, isn't it all gone?
Oh, yes, toast.
Toast, right?
Toast. Yeah, because proteins get denatured in heat and it's 450 degrees for 3 hours. There's nothing left of that but cancer. It literally, they're eating cancer.
Carcinogen.
Like, why would you do that? It's stupid. It's completely stupid.
I've never done it once.
And people do it because they think it's beneficial because some lunatic on the internet told them that.
No.
I had a long consult with a couple yesterday. It was a long consult. I was on there for an hour. So every time they would say, well, our RE said this, and he said there's no evidence for this, and I'd pull up a study. They're like, our RE said, and Toronto-based REs, our RE said that there's no evidence for testosterone, so I pulled up a meta-analysis on testosterone. There's no evidence for human growth hormone, so I pulled up the meta-analysis on human growth hormone. I'm like, if you're going to talk about something, and this is why the Dick Awards are so important. If you're going to talk about something, you got to know what you're talking about. Like, you got to have a study to back it up, right? Or it's got to make very clear common sense, right? Like, don't eat char. I mean, char is
Don't eat char.
Don't eat char.
When I get char on my toast,
Yeah.
or on a pizza, like I say, I'm putting pizza in the barbecue.
Yeah,
Maybe
yeah.
a bad example, but
Yeah.
when there's char on it, the first thing I do?
You scrape it off.
I scrape it off. I say to myself, this causes cancer. Don't eat it.
Yeah. Yeah. It's not good for you.
That's just on pizza dough.
Yeah.
Like normally people eat.
Yeah.
Forget about. Yeah.
I know. It's crazy.
Welcome to the wonderful world of infertility. So many questions. Hey guys, scan pre-FET cycle and lining was 8 millimeters. Relief because thin lining issues pre-pregnancy. Now on medicated FET cycle and lining CD18 is only 5.5. How could 5.5 millimeters? How could this be?
I mean, maybe you released an egg, maybe you're on progesterone, maybe your cycle wasn't great. We don't do medicated FET cycles, so there's lots of better options, but I don't know why that's happening for you. 9 o'clock.
9 o'clock.
It is 9 o'clock. Yeah. One more. Tarek's terminal question.
The pressure.
The pressure.
Comment, maybe they should freeze dry the placenta instead.
No, because there's no proof that eating placenta is of any value whatsoever. None. Like, there's no proof that it does anything whatsoever for anybody. Don't be eating placenta. Someone asked a question right before it says, what on earth are we talking about?
Yeah, well, the placenta conversation was wild.
No. But before that, someone had asked a question, but I can't see it.
Before the placenta.
Something about Lupron and intralipid.
Yeah, I got it here for you. Okay, last question. Ready?
Sure, yeah.
7 failed FETs, 2 imports, last 3 transfers were immune protocol and intralipids, Lupron. Try again?
No, talk to me first and let's figure out what's wrong. Do not try again. That's crazy. That's crazy. Talk to me first and let me help you figure out what's wrong. Yeah, there's got to be something. So let's figure it out together. Okay, next week. Should we do egg freezing next week? I think we should do egg freezing next week.
Absolutely.
And we got to, are we going to do the Dick Award as part of the show? I don't think we can.
It's hard. There's a setup required for that. You need to, look the part.
I need to look the part. Yeah.
And we're gonna ask for.
We could pre-record it and then play it at the start of the show.
Yeah, maybe we could do that. Well, first I have to get the nomination set up.
Yeah.
Well, it's going to be on your website, 100%.
Okay.
Submit someone for the. We'll figure out.
Submit something for the Dick Award.
Yeah, that's right.
Okay, so watch on the website, guys, for the Dick Awards.
yeah, absolutely. It's gonna be good.
It'll be good. Have a wonderful night. Good luck in your journeys. Let us know if we can help. As always, always happy to do what I can. I don't know if you guys checked out the latest post I put up, but it was from a lovely, lovely, lovely couple who lived halfway across the world and couldn't make it to us for financial reasons, but they just listened to what I said and they got pregnant. So a lot of this, you don't need to come to us.
Kourtney Kardashian ate her placenta.
Yeah.
And the whole world started. Just proves how easy it is to influence people.
Yeah, exactly. I mean, if Kourtney Kardashian did it, it must be right.
It must be the right thing to do, 100%. That girl is perfect.
One of our biggest posts ever was that blonde chick from
The Liver Eater?
The Liver Eater. What was her name? The one that went and did all the plastic surgery.
You know what the problem was with that video?
Heidi Montag. Heidi Montag.
It was the sound she made.
Heidi Montag just chomping into that raw liver.
Chomping.
Yeah. Stupid.
Wild sound effects.
Stupid. And people think that because they're famous, they should follow this. That's insane. It's insane. It makes no sense. Anyways, have a wonderful night. The Dick Awards should be really fun. Look for the Dick Awards, and we love you guys. We will see you next week on Fertility Fact or Fiction. And hopefully I will teach Tarek how to surf this weekend with some luck. Take care.